After all, everywhere you look, vitamin B12 is being promoted as the miracle energy vitamin. And it's in your multivitamin, it's in energy drinks, it's in those tiny dissolvable tablets your friend at church swears by. Your doctor may have even mentioned it once when your levels were a little low. So you start taking more and more. Because B12 is water soluble, right? That means your body just flushes out the extra. That's what everyone says. But here's the question almost nobody asks after 60. How much B12 is too much? And more importantly, could taking too much actually be masking something more serious? If you're over 60, your body does not process vitamins the same way it did at 30 or even 50. Your stomach acid changes, your absorption changes, your medications may interfere, your kidneys may not clear things as efficiently. What worked for your neighbor might not work for you. And here's where it gets even more important. Many adults over 60 are taking 1,000 micrograms, sometimes even 5,000 micrograms daily. But the recommended daily amount for most adults, just 2.4 micrograms. Yes, you heard that correctly. So why is there such a huge gap? Is it harmless? Is it helpful? Or is it one of those more must be better assumptions that quietly builds up over time? In today's video, we're going to calmly, clearly, and honestly break this down. No scare tactics, no internet myths, no supplement shaming, just real information you can understand. We'll talk about why B12 becomes more important after 60, what high levels actually mean, when extra B12 might be necessary, and when it might be unnecessary or even risky. Because at this stage of life, it's not about taking everything. It's about taking what your body truly needs. So before you open that next bottle, stay with me. What you learn in the next few minutes might completely change the way you look at B12 after 60. As we move past 60, vitamin B12 stops being just another letter on a supplement label and becomes something much more personal. It becomes connected to your memory, your balance, your nerves, your mood, and even your ability to feel steady on your feet. And yet, the way your body handles B12 changes quietly over time. When you were younger, your stomach produced enough acid to separate B12 from the protein in food. That acid was like a key unlocking the vitamin so your body could absorb it properly. But with age, stomach acid naturally decreases. Some people also develop conditions like atrophic gastritis, which further reduces acid production. Without enough acid, even if you are eating meat, fish, eggs, or dairy, your body may not absorb B12 efficiently. On top of that, many adults over 60 take medications that interfere with B12 absorption without realizing it. Common drugs for acid reflux, heartburn, or stomach protection reduce stomach acid even more. Certain diabetes medications can also lower B12 levels over time. So now you have a situation where intake might look fine on paper, but absorption is weaker than it used to be. This is why doctors often see low or borderline B12 levels in older adults, even in people who believe they eat well. B12 is essential for making red blood cells, maintaining healthy nerve cells, and supporting DNA production. When levels drop too low, symptoms can be subtle at first. Mild fatigue, slight numbness in the fingers, a little brain fog, maybe a mood shift that feels like aging or stress. Because these symptoms overlap with so many other age-related changes, they are often dismissed. But prolonged deficiency can lead to nerve damage, memory issues, balance problems, and anemia. The body gives warnings, but they are quiet warnings. This is why B12 becomes more important after 60, not less. Your need for it does not dramatically increase compared to younger adults, but your risk of deficiency does. That difference matters. It explains why supplementation is sometimes recommended for older adults, especially if blood levels are low or borderline. It also explains why higher dose supplements exist in the first place. They are designed to overcome reduced absorption by providing more than the body technically needs, knowing only a fraction may actually be absorbed. However, importance does not automatically mean excess is better. The goal is not to flood the body with massive doses without understanding your levels. The goal is to ensure adequate absorption and maintain healthy blood levels. For some people, a small daily supplement is enough. For others, especially those with absorption issues, higher doses or even injections may be appropriate under medical supervision. What makes B12 different after 60 is not that it becomes dangerous by default, but that the balance becomes more delicate and thoughtful monitoring becomes more valuable than guessing or assuming more is always safer. When people hear that their B12 levels are high, the first reaction is often confusion. We are used to hearing about deficiencies, not excess. So when a blood test shows a number far above the minimum range, it raises questions. Is that dangerous? Is the body overloaded? Or is it simply passing through unused amounts from supplements? To understand this, it helps to know what a blood B12 test is actually measuring. The standard test measures the amount of vitamin B12 circulating in your bloodstream at that moment. It does not automatically tell you how much is being actively used inside your cells, and it does not always reflect whether your tissues are functioning normally. This is where things become more nuanced. Some people can have normal or even high blood levels, but still show functional signs of deficiency at the cellular level. That is because B12 must bind to certain transport proteins to enter cells and do its job. If that process is impaired, blood levels may appear elevated while tissues are not using the vitamin effectively. On the other hand, many older adults who take high-dose supplements simply show high blood levels because they are consuming far more than the body needs, and the excess circulates temporarily before being excreted in urine. Another important point is that there is no officially established upper toxicity limit for B12 in healthy individuals. Unlike fat-soluble vitamins that accumulate in body tissues, B12 is water-soluble. In most cases, excess amounts are not stored in large quantities but are eliminated through the kidneys. That is why doctors historically considered it very safe even at high doses. However, very high levels on a blood test can sometimes signal something unrelated to supplements. Certain liver conditions, kidney problems, or blood disorders can cause elevated B12 levels because the body is not processing or clearing it normally. In those cases, the high number is not caused by taking too much, but by an underlying health issue that needs evaluation. This is why context matters so much. A slightly elevated B12 level in someone taking 1,000 micrograms daily may not be concerning if kidney and liver function are normal, but a very high level in someone who is not supplementing at all deserves closer investigation. Doctors sometimes order additional tests such as methylmalonic acid or homocysteine to better understand whether B12 is functioning properly at the cellular level. These markers can help determine whether high blood B12 reflects true excess or a more complex metabolic situation. For adults over 60, the key is not to panic at the word high, but also not to ignore it. Blood results should be interpreted alongside symptoms, supplement use, medication history, and overall health. High levels do not automatically mean harm, but they are a signal to look at the full picture. The number on the lab report is only one piece of information, and understanding what it represents requires careful evaluation rather than assumption. There are situations after 60 when extra B12 is not only reasonable but necessary. The key difference is that supplementation in these cases is targeted and intentional, not just something added casually because it sounds beneficial. One of the most common reasons for higher B12 intake is confirmed deficiency. If blood tests show low levels, especially along with symptoms like fatigue, numbness, tingling, memory issues, or anemia, doctors may recommend higher doses for a period of time to rebuild stores. In these cases, 1,000 micrograms daily or even periodic injections are used because only a small percentage of oral B12 is absorbed through passive diffusion when stomach acid or intrinsic factor is limited. Intrinsic factor is a protein made in the stomach that binds to B12 and allows it to be absorbed in the small intestine. Some older adults develop a condition called pernicious anemia, where the body does not produce enough intrinsic factor. Without it, even if you consume adequate B12 in food, absorption becomes severely limited. In this situation, high-dose oral supplements or injections bypass the normal absorption pathway and ensure the vitamin enters the bloodstream. For someone with pernicious anemia, higher doses are not excessive, they are medically appropriate. Another group that may need additional B12 includes individuals who have undergone certain gastrointestinal surgeries. Procedures involving the stomach or small intestine, such as gastric bypass, can reduce the area available for absorption. Over time, this can lead to deficiency unless supplementation is adjusted accordingly. Similarly, chronic digestive conditions like Crohn's disease or celiac disease can interfere with nutrient absorption. In these cases, standard dietary intake may not be sufficient to maintain healthy levels. Long-term use of certain medications can also increase the need for B12 supplementation. Metformin, commonly prescribed for type 2 diabetes, has been associated with lower B12 levels over time. Proton pump inhibitors and other acid-reducing medications can decrease stomach acid, making it harder to release B12 from food. When these medications are necessary for managing other health conditions, doctors may monitor B12 levels more closely and recommend supplementation if levels begin to fall. Vegetarians, and especially vegans over 60, may also require supplemental B12. Since natural dietary sources are primarily animal-based, limiting or eliminating these foods increases the risk of deficiency. While fortified foods can help, they may not always provide consistent intake, particularly if appetite decreases with age. The common thread in all of these scenarios is that higher B12 intake is guided by a specific reason. It is based on laboratory results, medical history, medication use, or dietary pattern. It is not about assuming that more equals better, but about correcting or preventing a measurable risk. For many adults over 60, a modest supplement is sufficient. For others with absorption challenges or documented deficiency, higher doses are part of a structured plan designed to restore balance and protect long-term nerve and blood health. There are also many situations where taking large amounts of B12 is unnecessary and sometimes even misleading. One of the most common assumptions is that if something gives you energy, more of it must give you more energy. But B12 does not work like caffeine. It does not create energy on its own. It helps your body convert food into usable energy at the cellular level. If your levels are already adequate, adding more does not suddenly boost stamina or sharpen memory. It simply circulates in the bloodstream and is eventually excreted. In other words, once your body has what it needs, extra B12 does not provide extra benefit. For adults over 60 who have normal blood levels and no symptoms of deficiency, routinely taking very high doses such as 2,000 or 5,000 micrograms daily may not offer additional protection. The recommended daily intake for most adults remains around 2.4 micrograms. Even accounting for reduced absorption, many people can maintain healthy levels with modest supplementation, often in the range of 25 to 250 micrograms, depending on individual needs. Jumping to extremely high doses without testing can create a false sense of security, as if the supplement alone guarantees protection against fatigue, memory changes, or nerve issues. Another concern is that very high B12 intake can sometimes mask other problems. For example, symptoms like tiredness, weakness, or numbness might be attributed to low B12, leading someone to increase their supplement dose repeatedly without confirming the cause. Meanwhile, the real issue could be thyroid imbalance, anemia from another source, blood sugar instability, or neurological conditions that require different treatment. Relying on high-dose B12 as a catch-all solution may delay proper diagnosis. Although B12 is generally considered safe because it is water-soluble, extremely high blood levels have been observed in some studies alongside certain health conditions. Researchers continue to examine whether high B12 levels are simply markers of underlying illness or if there is any direct effect from chronic oversupplementation. While clear toxicity from B12 is rare, the absence of confirmed toxicity does not automatically mean that megadoses are beneficial for everyone. Balance is still important, especially when kidney function changes with age and the body's ability to clear excess substances may slow. There is also the psychological side of supplementation. After 60, many people begin adding more and more vitamins to their routine, hoping to prevent every possible decline. The cabinet fills with bottles, each promising vitality and longevity. But health is rarely built on excess. It is built on appropriate targeted care. For many older adults, maintaining healthy B12 levels is about monitoring and adjusting thoughtfully, not pushing the dose higher and higher without clear reason. Sometimes the wisest approach is not adding more, but understanding whether what you are already taking is truly necessary. After 60, the most powerful tool you have when it comes to B12 is not the size of the supplement bottle, but information. Guessing your levels based on how you feel is unreliable because symptoms of both deficiency and excess can overlap with normal aging. Fatigue, mild memory lapses, changes in mood, or tingling in the hands can have dozens of causes. That is why monitoring becomes more important than assuming. A simple blood test can give you a starting point. It shows whether your levels are low, borderline, adequate, or elevated. From there, decisions can be made calmly instead of reactively. But testing once and forgetting about it is not always enough. As we age, our health status changes. Medications are added or adjusted, digestive function shifts, kidney and liver performance may evolve. A level that was stable 3 years ago may not look the same today. Periodic monitoring, especially if you are supplementing regularly, helps ensure that you are staying within a healthy range. It also prevents the common cycle of increasing doses year after year without ever checking whether they are still necessary. Communication with a healthcare provider is another key part of the equation. Supplements are often treated as harmless extras, separate from real medicine, but they interact with the body in measurable ways. Letting your doctor know how much B12 you are taking, how often, and in what form allows them to interpret lab results accurately. If your blood level appears high, they need to know whether that is likely from supplementation or something else. If it appears low despite high intake, that may signal an absorption issue that requires further investigation. Individual factors matter more after 60 than they did at 30. Your dietary pattern, digestive health, medication list, kidney function, and even genetic variations can influence how you process B12. There is no universal dose that fits every older adult. Some thrive on small daily amounts. Others require structured higher doses due to specific conditions. The goal is not to chase the highest number on a lab report, but to maintain levels that support healthy red blood cell production, stable nerve function, and cognitive clarity. Ultimately, managing B12 after 60 is about balance and awareness. It is about using supplements intentionally rather than automatically. It is about adjusting based on evidence rather than fear or marketing claims. When you combine thoughtful testing, open communication with your healthcare provider, and an understanding of your own body's changes, you move from guessing to guiding your health with clarity. And at this stage of life, clarity is often more valuable than excess If you're over 60, vitamin B12 is not something to ignore, but it's also not something to overdo blindly. The real takeaway isn't fear, it's awareness. Your body changes with age, absorption changes, medications matter, lab values matter, and what worked for you 10 or 20 years ago may not be exactly right today. B12 can be incredibly important for protecting your nerves, your memory, your energy, and your blood health, but more is not automatically better. The goal is simple, not the highest dose, not the lowest number, but the right level for you. If you're supplementing, know how much you're taking. If you haven't checked your levels in a while, consider asking your healthcare provider. If your lab results show something unexpected, don't panic, ask questions, and look at the full picture. After 60, good health is rarely about extremes. It's about steady, informed decisions made over time. And sometimes the most powerful step you can take isn't adding another pill, it's understanding why you're taking it in the first place. Stay informed, stay balanced, and take care of your body with intention.